Hi everybody and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, co-founder of Kidney Coach and Kaigenesis, a range of supplements designed for those diagnosed with chronic kidney disease, whether you want to increase your EGFR or decrease your creatinine. And I'm joined again today by the wonderful, the lovely, the fabulous Dr. Robin Rose. Dr. Robin Rose, born and raised in Brooklyn, Jersey, but she's now living in the wonderful tropical lands of Hawaii. She began her life journey in New York as you were a ballet dancer. I love every time I do this, I look at a different introduction for you and I just learn more and more about you. But ballet dancer, which makes sense because you look like you could have been a ballet dancer. And then she started her medical journey in 1970, where she shadowed an MD while living in a fishing village in India. You've done it all, Robin. And then you studied plant-based medicine and vegetable cooking and serving in communities. And then I know you became a nursing assistant, and then you graduated from honours from the University of Tennessee in health science as a nurse practitioner. And then you went on and you did your MD basically at, I want to say Arizona. Did I get that right?
Yeah.
Yeah. And then you ended up with having kidney cancer yourself. I'm skipping a whole pile of things that she's done in there in between. And then you really shifted your practice and your focus and really became kidney focused. And Dr. Rose is my go-to for all things Bioregulators. She runs a Facebook page, Pep Docs, which I'm very grateful to be a part of. It's such a great community of doctors using peptides and sharing, because it's such a new and evolving and emerging science, right? So you've got some very intelligent people on there sharing their journeys, and we all get together and brainstorm. I would say Dr. Rose is very good at creating community. I think that's something naturally that she does. She's very generous with her information and just really wants to get good solid science out when it comes to kidney disease, but especially, you know, tubular dysfunction and all the things that happen in stage 1 to 2 kidney disease, and even prior to that. And she's been so great in her knowledge. I know I was just training a whole pile of doctors, and I was training in tubular dysfunction and what tests to look at, and that all that information comes to me from Dr. Rose. She gets me curious about things, and then I end up down some great big rabbit hole about learning about retinal proteins and how they come through the tubules early, and then gets me thinking about, you know, we were talking about anyone that I think is metabolic should be tested for tubular dysfunction. And I think they're, you know, if we could get really good at picking up changes to, you know, tubules well before, we could basically circumvent and prevent a lot of kidney disease. So welcome back to the podcast, Dr. Rose. And if you haven't been paying attention, we're doing a series on bioregulators. Dr. Rose has an amazing book that I'll get her to hold up and share. Renology is kidney success. There it is. Renology peptides and all the bioregulators in there. So we are working our way through there. So if you haven't listened to any previous podcasts, go back and listen. We definitely start with Pilotax, which is the kidney bioregulator. We've worked our way through the parathyroid. We've done blood vessel. We did we do bone? Did we do bone marrow? Have we done that one yet?
Not yet, I think, but we did carnosine.
Carnosine, that's what I think.
Beloved 2-amino acid friend.
You do love old carnosine. I've reawakened my love affair for it too. But today we're going to talk about the heart bioregulator, and for very good reason. And I'm going to hand it over to Dr. Rose to tell you why the heart bioregulator is something we should be thinking about for people with chronic kidney disease. To you, Dr. Robin Rose.
So when I think about kidney, I think about heart in one thought, because I'll tell a story. Is that okay? So I live on a small island, and doctors will come. So the eye specialist was seeing my husband, and I said, "So, Doc, what's the connection between the eye and the kidney?" And he went, nothing. All right. Then I saw the optometrist, and I asked her the same question. And she said, "Oh, they're both vascular organs, very similar effects." Then I actually had cataract surgery, and that ophthalmologist, I asked him, and he said, "Do you have all day?" So not everybody realizes that kidney is really a blob of blood vessels, and it's in total sync with the cardiovascular system. We've talked about the blood vessels, but the heart muscle itself is affected by decline of kidney. And so here's a statistic that blew my mind when I was first sick. I mean, my story was I got out of surgery with promises, no worry, you can live with one kidney. And I Didn't have any reason to doubt that until I woke up one day with a GFR of 30, about 25% function. That was like a, oh my God, help me. And that was the beginning of an odyssey to figure it out. GFR now 68 with one kidney, thank God. And I did a small class with a nephrologist who did a video class for all the different islands. And she gave a statistic at that time. She said, think of stage 3, which is finally when conventional medicine says, oh, there's something going on. Unless you have protein in your urine, GFR 60, which to me is 50% loss already, and to GFR 30, stage 3, you'll be okay, don't worry. Is unfortunately too many people hear that. But she said, okay, here's a statistic. Stage 3, there's 3, 7 million patients. Stage 4, 400,000. So the question is, what happened to all those people? Did they get better? Unlikely. The enhanced risk of cardiovascular disease, which, in vernacular, strokes and heart attacks are way more likely. In fact, I've seen various statistics, some of them between 10 times up to 100 times risk of having cardiovascular disease. So if I'm looking at somebody with kidney, I know that the support needs to be there. If their blood pressure's normal, I don't really care. Still need to do more natural, more lifestyle, more low-hanging fruit kind of cardio support. And of course, we have to say, you can't just eat bad, not sleep good, not drink enough fluids, not exercise, too toxic, and think anything's going to help. It's really, the buck starts and stops here. And then there's this world of incredible, very non-toxic tools that can enhance that. So you get your money's worth out of making this effort. And I did an interview with a beautiful healer chiropractor who told me her first question that she asks her patients is, do you believe you can heal?
Oh, great question.
And I've started using that, and so I do a lot of metaphysical stuff with kidney. And when you think about heart, there's belief and there's joy or sadness. I mean, there's that goes with lung a little bit, but the joyousness of life includes being joyous that I can make a choice of what's in my cup. I can choose to do what's most optimal for me. Sometimes I choose stuff that's not perfect. And then I have to go, all right, I don't have to be perfect. I'm going to keep trying to be as good as I can. So, we get to the heart and it's like, I started this out. I didn't have high blood pressure. It evolved before I could figure out, like, all right, what do I do here? And, and the risk of congestive heart failure is enormous with kidney disease. That means there's scarring. There's scarring happening in the kidney. There's scarring happening in the heart as well. And so it really is just awareness. And I'll share another story. Behind closed doors, you find out there's interesting things going on. I saw a cardiologist when my GFR was in the 30s because I saw, I have some changes. I want some cardio support. And I've never had glomerular disease, think kidney tubules and toxins. And I didn't have protein in my urine. And so this very lovely cardiologist gets in my face and does the harassment thing. Repeat after me. I don't have kidney disease. And it's like, could I educate you a little? Because this doesn't make any sense to me. I have a GFR that's like 35. And so he read some and turned around, called me, and actually apologized and said, "Oh my God, you're really right. Wonderful." But what that tells you is the general public and even the general public of physicians may not know the extent of damage that comes from declined function and the downstream. So what does that mean? It's like, all right, my filtration isn't good, so what? My tubule's not working means stuff that I need to keep, I'm excreting. Stuff I need to excrete, I'm keeping. Okay, that's all, toxic to many cells, but in our conversation now, it's so heart stressful that you go, oh, let's have a conversation of what to do. And of course, when I found the bioregulators, I was elated because, again, I'll do my cartoon. There's cells. You can't things just don't get in cells. They got good borders, and they have border patrols that allow you in or not. But tiny things can sneak in through the gate without being noticed. There's little transporters. And so these small molecules get through the cell membrane. They also get through the nucleus into the nuclear membrane. And then, you know how DNA is this lovely thing. It actually lodges in DNA, stretches it open, works with the histones to reverse epigenetic damage. That means life damages what the machinery we came with, but in the light of the bioregulators, we can actually reverse some of that, which means proteins that we need to live on, in this case, proteins that repair the heart, that keep it from scarring, that keep it contracting well, are replaced. Vitality back.
Such an important conversation. And yeah, exactly. I think to your point, like heart disease is the second leading cause after diabetes of kidney failure, but heart disease is the biggest killer of people with chronic kidney disease. To your point with your numbers, that's crazy. What, 7 million to what was it? 400,000 or something?
100,000. And my husband says, oh, no, 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 no. It's actually 13 million.
Right. Where do they, like you go, where do they disappear now? Yes, a small percentage might have been reversing, but most of them are probably dying from heart disease. Like heart disease is one of the biggest killers in the US and the Western world. And that the role and the bilateral direction, and you and I are always talking about like kidney gut access and kidney liver and kidney parathyroid and kidney heart and kidneys really, because as you mentioned, kidneys are highly vascular, and so they're pulling in everything from the heart. And so vice versa, if that vascular tissue and the heart's not pumping it properly, we're going to see issues. So you've talked about what bioregulators are and why they're so amazing, because they don't need the gatekeepers. Talk to me about specifically when you would, because there's so many bioregulators, right? You and I had a conversation before about how many do you give to people? How do you stack them? How long? We're playing with different protocols. Now, it's a question we get actually in the comments a lot on YouTube channel is, how long do I take them for? How many dosing? And the standard dose and the standard sort of thing, and I'll let Dr. Rose speak to this, is I generally in practice use 3 bioregulators at a time. I use them a lot longer than the 10 days because I've just found I have to for chronic disease. But when would you think, this is what people ask, when will you think about using heart over, say, some of the other bioregulators that we've talked about, like Pilatax, Boncafort, all the, parathyroid blood vessel? When would you start thinking about using the heart? Is it one that you're going to use in all chronic kidney disease because of this connection? Do you dose it differently? Walk me through some of that, and walk me through some of the things, because we know bioregulators don't just do, what you go heart, okay, it just does that. I know it has a far wider reaching range. So walk me through all of those amazing things in your book about heart bioregulators, and then let's get into the nitty gritty of dosing and stacking and those sort of things, because that is the question I'm getting a lot on the YouTube channel about how we use them and use them together.
I personalize. I never have protocols. I mean, I have ideas, but each person presents a unique collage, family history, stresses, toxin, all of that stuff. So, people ask, well, how do you usually do this? I'm like, I don't know, because I don't usually do anything. But, with CKD, certain things are basic. And so, the major organs are important. Brain, heart, kidney are kind of the major 3.
Yeah.
So at some point in every single protocol for somebody with diminished kidney function, heart's going to come in there. Do they already have some cardiovascular stuff? It's going to go higher up on my list. Is somebody autoimmune and stressed? I might take a little bit different path with them. Use more thymus and adrenal. It really depends on what's screamingly important to that person. What am I hearing? And I encourage people, listen, what are you hearing? What do you think's really going on? And so, I just created a protocol for somebody, and I didn't put heart until like later on. I think I did a 6-month plan. And that's something to know. Whereas I did kidney, prostate, because he had prostate issues. And interestingly enough, I was just reviewing, Cardiogen, the synthetic heart bioregulator. I can
Cytogen.
I can spit this out. Actually works on heart and prostate.
I had read that.
Right. I forgot about this, and so, I have the book open here. Alters expression of signaling factors in prostate fibroblasts because it works on the fibroblasts, which what's happening with that scarring. And so, so I'm not really answering the question well, but I also need people to understand there's a bunch of lab work that I like to get. Start with phosphorus. Phosphorus is on many panels. It's easy to come by. And again, the normal range is not normal for kidney. The middle of 3.5 and above, you're already getting cardiovascular damage. That gets ignored. I don't think many people are aware of this. And so that FGF 23, another lab you can get, TMAO, ADMA, homocysteine. Kind of a nice little package. Okay, you can get your lipid panel, get the advanced lipid panel, because there's truth in inflammation. But there's definitely a reason to consider having the 3 big ones pretty consistently. And I'll do 6 bioregulators at a time to get people going and then thin it down. The idea isn't that you take these forever.
No, that's what I like about them because they're really changing gene expression, which again, we've said this and everything, but they blow my mind, and I'm always blown away that people aren't more excited about them because I don't know, people are like, well, don't peptides do the same? And I'm like, well, no, they're sort of up or down regulating certain biochemical processes. As far as actually changing gene expression, I'm sure stuff does it, but I haven't seen things do it like bioregulators do. Like Vilon was my first experience with that. And actually, Vilon and the liver bioregulator of just how it will unfold chromatin and do all these amazing things. And I'm like, I don't know anything else that really does that. So they excite me to bioregulators. So you're all good. I can still see you and hear you.
I'm not hearing you. Can you hear me?
I can hear you perfectly.
What happened?
Did you accidentally mute me down the bottom?
God.
Hang on, I'll pause for you. Okay, we've got you back. This is good. So keep going, Robin. What were you saying? She's like, I can't remember what I was saying now. But you were saying you often use 6 to get people going, and I was talking about how excited I am about the fact that they change gene expression and things like that. So, and I don't know, unless you do, of anything else that does that, because my understanding is that's not how peptides work. They're up and down regulating biochemical processes.
Right. I've had this conversation with Phil Mikens, who wrote a book with Professor Haavinson, who discovered these. So, he's like the nitty gritty of understanding this stuff. And he's like, people are selling products and saying they're bioregulators. They're extracts. They're not bioregulators. And not every peptide does this gene switching, which doesn't mean they're not useful for something else. BPC, KPD, they're lovely. They're not gene switches though. And so, because kidney disease is a progeric disease. It's a pro-aging. It accelerates it. It's a senescent disease, meaning cells become zombies and start eating, but they don't do anything, and then they poison the neighbors and cause, inflammatory
Yeah,
problems.
yeah.
So, the idea of having these skills, I mean, the bioregulators are very potently active in those places, That's why the whole longevity movement is all excited about this. To me, treat a disease, you'll live longer.
100%. And at the end of the day, this is a conversation I have is because I've got a chronic disease, I've got no interest in living longer, stuff that, but I have an absolute interest in living with a good health span, meaning cognitively functioning, a vibrant, abundant energy, all of those sort of things. And that for me is the whole point of what biohacking should be. Like, why would we want to live longer if we're not doing it with health? And so bioregulators play such an important role in that as far as tissue regeneration. And if you've got things that can unsilence DNA that might have been silenced by a virus and switch it back to when you were, like I say, Villon was my first experience of understanding just how deep these things work. I love Villon. I'm just like, wow, like I don't know anything else that does this. And why aren't we using this in every patient as a sort of building foundation and stacking our nutrients on top of this? That would make more sense to me as a practitioner. But I want you to dig into me more about the heart bioregulator with that amazing book of yours. Tell me, what did you discover that the heart bioregulator had the ability to do? What mechanisms does it work on in the body? And walk me through some of those processes of all things heart bioregulator.
Well, it works at the fibroblast level, which is really fascinating to me. And it also works on the muscle itself. I mean, this isn't focused on the blood vessels. We have another one that's very specific for the systemic purpose. The heart muscle itself can end up being damaged by declining kidney downstream effects. So, by itself, it's like, okay, that's interesting. I'm not filtering well, but the consequence of that is a big deal. And so we see people who are at risk for heart attacks and strokes. Okay, consider heart. That heart muscle has to be working. It will actually work as an anti-arrhythmic. So somebody with atrial fibrillation would benefit from this. There's people who have angina, sometimes shortness of breath, chest pain. That's another indication. And that's another place where interfering with fibroblast dysfunction ends up being reversed by the effects of the bioregulator.
For anyone that doesn't know what fibroblasts are, tell us more about that.
I think of connective tissue. I mean, think of scarring, and here's these little things. I love this image way back in school. Here's a cut. If you sew it up, it just heals nicely, right? You suture things up. But if you don't, they're like snake-like little cells, and they toss themselves across. And we all know what a scar looks like. Well, that's good if you cut your skin, and okay, it may not be perfectly beautiful, but all right, it's working. In your major organs, you have scarring and things don't work, and that's a massively important thing in the heart. The muscle isn't going to be adequately contracting, which means blood flow and oxygen and nutrients are not optimal. So in a sense, it's like the body, the cells starve for lack of this muscle being effective. And in time, that's congestive heart failure. I don't like the term because, failure is a long time, just like with kidney, it's down the road. But, poor contractility is going to mean you're not breathing good, your legs are swelling, you're fatigued, short of breath, your brain's not working. I mean, it's a very unpleasant way to live. And so, that's where I'm looking. It says stimulates cardiomyocyte proliferation. So that means your cardiac muscle cells, the heart muscle cells, are actually supported to regenerate. And, as we just said, if you're losing heart muscle due to scarring, this is on the menu. I want some.
I've got a question for you because of my curious brain, and your brain and my brain works a bit similarly. We know that part of the problem with kidneys is fibrosis, right, and scarring. And you mentioned before that the heart bioregulator will have an affinity for the prostate. Do you think, maybe we may not know about it, that the heart bioregulator, because of its affinity for fibroblasts, might actually help? Is it a fibroblast process happening inside the kidneys, and therefore maybe the heart bioregulator, if you've got a lot of scarring inside the kidneys, that's another time that you might think of using it?
Interesting. And I don't know. I mean, that's really ultimately a fabulous question, which I'm going to write myself a note. You always ask me questions, and I'm like, I got to look this up.
Yeah, because it's, like my brain just puts that together, and I'm like, well, surely if it can reduce blastic activity inside the
I know,
prostate.
and I don't really know why is it specific to
Yeah,
prostate. I
yeah.
don't actually have that in the book and didn't see it anywhere. I was just like, oh, cool. For a man with kidney stuff who's maybe has high blood pressure, but the prostate, I mean, I've talked to a number of men recently whose prostates
Mm.
are why their kidneys are going out. And
100%, me too. I've got one, my patient after this podcast is exactly this. So now I'm like, heart bioregulator.
whether, and are you going to use, you can do this injectably, the cardiogen you can inject, you don't have to. Kilo heart is a little bit more of a um, bulky molecule, so maybe it's better to use it, for a prolonged period of time. But I mean, they did a lot of studies, some of them small studies. The Russians got lots of research money and have seen 2 million patients using bioregulators, probably more by now,
Yeah.
but I mean, I have a list here: coronary artery disease, hypertension, atrial fibrillation, myocarditis. What have we been seeing a lot of? Um,
Mm.
heart attacks, heart failure, people who are very physically active but can't meet their athletic needs because of maybe limited heart function. Throw that in there. Elders. I mean, anybody who's getting older needs to support organs. I mean, we know this. You live long enough, the toxins accumulate.
Yeah.
Just, sitting in a beautiful place breathing, I'm getting toxins. And so doing things over time to remediate that means that your organs will work better. That's why I like the bioregulators, because they really address this at this place. I also have written in here regulation of hormonal status for cortisol, epinephrine, and norepinephrine. Again, let's remember that kidney disease by and of itself imbalances the sympathetic and parasympathetic
Yeah.
nervous systems. And there's reasons, but essentially, I mean, even you can just imagine the body's going, oh my God, something's wrong. And I tell people, go to Vegas, like, let's get more vagal. And here's another way to do that. That's when I realize, oh, this person's really distressed. It's raising their blood pressure. They're not sleeping. Adrenal. So, we bundle all of these, and you just have to be creative. It's like, open the refrigerator. What are the ingredients? I'm going to make soup. And so we're creating a healing soup that evolves over time. As something's getting better, let's put this in this. We haven't used these. And, the point in the book is every single one of these has a role with declining kidney. You just have
Yeah.
to pick which is the worst one now, and then, oh, wait, we should have added a little pancreas. We should have, but you can't ignore heart. Mm.
No, and being such a leading cause of disease. I'm going to circle back. So it regulates cortisol, norepinephrine, and epinephrine. Is that right?
It has a role in that. Again, in the heart relationship of it.
Yeah.
Does that mean it's doing it in every other cell in the body? I'm not so sure, because we know that more or less they hone to the tissues from which they originate.
Yeah.
And so there's some exceptions to those, and the prostate part of this conversation is one. I am going to look into the kidney one. It's like,
Yeah.
and because I know that theoretically they hone to where they come from, maybe not. Maybe, the lung bioregulator would help fibrosis in the lung more than the cardiac one would help the lung.
Yeah, makes sense. Yeah, they're so fascinating, aren't they? Like I just go from my very logical, pragmatic brain, okay, it's working on fibroblasts, but like you say, it's potentially very specific to heart tissue and prostate for whatever reason. Then I'm going down, my brain's, I can feel it sliding going down. Is there a heart prostate connection in men that, haven't sat in their heart and this is driving prostate, like my whole brain goes there.
I like that. Yeah.
I don't know. We're going to have to ask our patients, but because I'm seeing exactly what you're seeing, all these older men with kidney and prostate and heart stuff. So yeah, it's fascinating. This patient after you, I'm going to have a conversation about does he live
And
from
a
his...
lot of times it falls through the cracks with conventional medicine. This one man I talked to, it's like finally he was like, well, I went from a GFR in the high 70s to the 20s.
Yeah.
Like, should we do something? I was like, oh, yeah, maybe, and it's such an interesting world out there to demand what you need without being nasty about it. But so I had to be really aggressive sometimes to get what I needed. Even diagnosed with kidney cancer, I had to use a word that I won't repeat here, that I want a CAT scan.
Yeah.
Have you ever thought of meditating? It's like, yeah, right. I've taught it for the last 50 years. How about a CAT scan, please? What I mean? So I know people are in that kind of situation. And that's why whoever's listening to this, God bless you, because you're getting information that you can thrive with, as opposed to getting gaslit. Don't worry.
Yeah, it's funny. My previous podcast, Stephanie and I literally had spoke about this topic and how, there's that whole trust the science, and that went out the window when we went through COVID, and people don't. And people are doing a lot of this. They have to. And then, of course, the medical establishment are like, well, now everyone's on Google, and there's good and bad to that. It definitely makes my life a little bit tougher. But I love a patient that is self-motivated to look. And at the end of the day, no one has greater autonomy and authority on your body than you. You're the one living in it. So if a patient goes, you know what, I know none of my tests are coming up with this, but I don't feel like something's right in there, I pay attention to that, because I'm like, they're living there. Like, I have to pay attention to that. So you're right, like taking this information. And the great thing about bioregulators is and I'll let you talk to this, but I've never seen them interact with anything. I've never seen them cause side effects. Have you yet in anyone, like, because I've been using them so much, and I've never seen it.
I mean, they actually enhance the effects of pharmaceuticals. So say somebody's on a blood pressure medicine or a diuretic, this will make them work better. I love that. And I have not seen side effects at all. I mean, and I've high dosed some people, and with the Russian studies, they did enormous doses.
I did.
I mean, the only side effect is money.
Yeah. And this is my next thing. I think this is a good point to talk to as well. And it's a little outside the side of the heart bioregulator, but bioregulators are not cheap. Good quality ones, and there's only a couple of brands that I will go near, and they really need to be coming out of Russia. Why are they, and I understand this, but people will ask, tell me about why they are so expensive, because they can be, especially if we're dosing high or we're doing 6 or 7, they can be cost prohibitive to people.
Well, here, I just had this conversation with Phil Mikens, who's a pharmacist in England who produces some bioregulators and wrote a book about them, a very scientific, intense book with
Yes.
Professor Robinson, who actually, well, you got the book. Yeah, I mean, it's a fabulous, I mean, it's some of it's over my head still. I keep going back to it and going, okay, that's what they meant. Anyway, we had a lovely conversation recently, And he was explaining to me how long it takes. We were talking about some products that he doesn't trust. And I want to know that because
Mm.
I have one kidney. I don't want anything toxic. What doesn't he trust about it? There's heavy metals that need to be purified out. There's prion diseases because these are coming from animals.
Mhm.
And so, that's not trivial. And it takes time. He said it takes many months actually of purification to produce these, like 3 months at least. And so right there, okay, that's some costly. And the good news is, you might do this for 3 months steady and then start cycling. So it's not something that you have to do forever. And I
No,
find that it's easy to get rid of some other supplements to take these effectively, and then you don't have the pill burden. Although nowadays they're talking about doing combination of 3 products, which I love that because you can do 2 of those at the same time and really
yeah,
just
exactly.
okay.
Yeah, they're combining them. I think it's a great idea. Yeah, it's funny. That's my experience in clinical practice, and I find that with peptides as well, that using bioregulators with some good peptides means that I can generally cut down supplements by 2/3. So people are using a third of what they're doing if you've got, and I think common sense, if we've got someone with, heart stuff or, maybe a family history and they've got a funky lipid profile and, slightly high blood pressure. If I'm using heart and blood vessel and maybe, a couple of peptides, then you can put in some coenzyme Q10 and, magnesium, and you don't need anything else. Like I don't need to add hawthorn and danshan and all the other stuff that I might have used before because of the way that the bioregulators enhance everything else. And so I
Or
found
you
in,
can cycle those too, like every now and then, like, a few days a month, throw in your herbs again, just to kind of, because every single substance has a little bit of a different activity,
true
you know.
story.
And then, and even in the same class of bioregulators, like you can use the cardiogen first. It's more acute, it's more intense. They're synthetic, but they take the identical little pattern of amino acids. The body does not question it. It's not like we need to respond to this. It's just recognized. It's like when people come here that my dog knows, he doesn't bark. It's like, oh, it's you. When
Yeah.
somebody questionable, he's yelling his head off. So, there's something, it's a good analogy. And so then you can switch to the more glandular version. I call it the more natural version because you take an animal body part and do the purification. There's a little bit more molecules attached. There's nucleic acids and vitamins and minerals. So it's a little bit more bulky and tends to be longer acting.
Hmm.
And, so even those are slightly different in what to expect.
And what about injecting versus capsules? So the original, the bioregulators were sort of always known as they're great because you can just take them in capsule form and not inject them. Obviously, if people are wanting labs, like I use a lot of stuff from BioLongevity, and they have a lot of the cytogens, you're able to inject them. And again, this is a question that's been asked under our podcast, when would you think about, say, injecting something like a cytogen versus using a Cytomax or using, oral versus injection? Is there a time and place for each, or does it not matter?
Yeah. The Russians would do the cytogen. The way that I remember this just took me a while. Like you generate those synthetically. Cytomax, they're bigger molecules. Okay, so you can remember this. Um, they will use the injectables first for more
Mm.
acute situations or kind of prime the system and then switch to the orals. And so, for one thing, you can't inject the orals because they're too bulky with animal-y things. You don't want to inject that. Whereas you can inject the other ones. I've had vegan patients who wouldn't use
Fine.
any of the Cytomaxes. And I'm like, okay, no problem. You can use the cytogens orally.
Yep.
And, there's a whole thing with epitalin and, the wonderful pineal one. Well, you can do it orally. Mostly we don't. We use it injectably. It's a little bit, there's something about you inject something, plus it's not going through the gut. We were just talking about this, in terms of things going through the kidneys and the kidney tubules. If somebody has a lot of tubular damage, it may make sense to do the injectable, at least for long enough to get things turning around, and then, the orals could support it. It's really just a creative endeavor. Each person, I sit and talk to somebody, sometimes on the screen, and it just kind of comes to me. I call this educated intuition. I'm weaving their story. Okay, here's somebody who's not going to want to shoot anything up. Needle phobia. Okay, we're jumping to the Cytomax. Other people won't eat animal product. So it really depends. I don't think you can mess it up. I mean, I know people are using way too high doses of injectable cytogens. They don't need to be that high. And so it's kind of fun because, with pharmaceuticals, we know, there's side effects. You got to be so careful. And here it's not, you don't have to be cavalier. Nothing can happen. I mean, there's always possibilities. I don't know, probably people can be allergic to the animal part of the Cytomaxes. I've not seen it. Um, and so, essentially it's just recognizing for yourself the risk. That's like insurance, like prevention. It's not like wait till I break and then do something. I mean, and that's a lot of what I was offered in nephrology was, well, when you're ready, we'll install plumbing. And I'm like, no, I'm interested in looking at what can I do today? Like, can we talk about protein? No, I don't talk about protein. Okay, can we talk about, no, and so the reason that we're having these conversations is because more and more and more and more of us need to know this and believe, yes, I can heal. I'm willing. I've been saying I'm willing to sacrifice on the altar of holy health.
Oh, I like that.
I've been reading. I'm getting biblical in my old age. So I love the imagery. It's like all these sacrifices they talk about. I'm like, well, what does that mean to me? Okay, when I found out that I had to make changes, I sacrificed beliefs. I believe this food is healthy. My husband, who's very smart and a nurse, said to me, "Well, it used to be healthy for you, but it's not health. It's not health food for you now."
Yeah.
Okay, I give it up. Um, it's like I don't want to get up and exercise. Okay, well, that's a choice. And I sacrifice what I wanna for what I really wanna. And what
Yeah.
I really wanna is to feel good and to be happy, healthy, holy, and full of life force. And I mean, I'm amazed. I mean, I was sick. I was really sick. I mean, my brain didn't work. I was depressed. I mean, I did stuff. People didn't know. I have one friend where I live who said, "Oh, I knew you were sick." Other people was like, "Nothing's wrong with you. You look fine." I was sick. And now, having gone through some years of making changes and learning about it, and looking at my labs, reading about that, you can look everything up online now. I'm sitting here in the middle in Timbuktu learning all this stuff because I have internet, and so to understand the importance of each one of these conversations that we're having is really important. It's like, kidney university to understand eyes are important. Eye health declines. Stay on top of it. Use different tools. You know, the thymus and the thyroid, big conversations. But to me, heart is really the crux of this big infinite connection and conversation between kidney declining, kidney fibrosis, leading to cardio aggravation, if nothing else, And I don't know the statistics. I mean, is there any advanced kidney patient that doesn't have any heart effects?
I don't know those stats either, but it's, I mean, like I say, I know that it won't be kidney disease that generally kills people, it's heart.
Exactly. And that was what that class taught me. I don't remember one other thing she talked about. It's just, I really don't. I mean, it was good, but this was just like, wow. Okay. That changes my approach from like kidney everything. What do I got to do with kidney? It's like, oh, cardiovascular health.
Yeah. Yeah, it's so important and it needs to be part of the conversation. Dr. Rose, what else do you want to say about the heart bioregulator? Anything else that it has an affinity for or it does? We covered it.
Yeah, I think we've talked a lot about this. Let me do a cheat sheet and see, what did we talk about?
What else have you got?
Contractile function, ischemia. That means, your heart isn't getting what it needs, so it doesn't work as well. Tolerance to stress tests, meaning tolerance to exercise. I love that. I mean, I noticed that. I would be like getting fatigued when I was like, hey, I used to be able to do this. It's getting better. Of course, does that mean I sit around and wait for that? No, get up and, you have a bad day, you can lay on your bed and do leg lifts. You can always do something. So as far as dosing is concerned, they come as 10 milligram capsules, for the orals. And how you dose it depends again on each specific case. And generally, my knee-jerk dosing is 2 capsules a day.
So,
I have given people 2 capsules 3 times a day at times when I felt like they needed it. I usually work up to that slowly just to make sure, am I tolerating this? I haven't seen anything that wasn't, but there's that. And then how long? Sometimes just 10 days, sometimes 15 days, sometimes 30 days, 60 days, 90 days. Again, how severe is this person's cardio status? Are you getting short of breath? Do you have chest pains, palpitations? You taking blood pressure medicines? What cardio testing have you done? It's worth knowing this stuff. And then, like you said, CoQ10. I like ginkgo. You have
ginkgo's
to make
great.
the right thing. Aged garlic extract is another one. The endocalyx stuff. We're talking vascular at this point, but they work together. And sit and envision. I've done meditations where I feel my pulse and just get in tune. What is my heart doing? Do I even notice it? I mean, I used to go to meditation retreats and I'm sitting there watching my physiology. I don't think that was what we were supposed to be doing, but how could a doctor not do that? It's like, what's my liver doing while I'm sitting here? But watching the heart, it's really, I mean, once you realize, like, the blood comes in and it goes to the lungs and comes back. I mean, it's a complex dance. And at any part of that, things can go wrong. And here we have a tool that basically contributes to our efforts to make it right. And it doesn't eliminate, if you need to take pharmaceuticals, it's not the end of the world. I personally, I do take a blood pressure medicine. I find that it actually just sort of calms out my system when things come at me. I don't react as much. I get it compounded by a pharmacist so that there's not nasty stuff that isn't good for me in there. It doesn't really cost that much. Um, but mostly, I mean, my personal belief is use lots of natural stuff first. You can always add the pharmaceutical. I mean, if it's an urgent situation, we're blessed to have the drugs. It just goes without saying. But some of us are a little recalcitrant, like, let me try other stuff first. And most of my medical practice has been like that. People who are so grateful to have a doctor not blaming them for not wanting a pharmaceutical. And, I've had people who made mistakes and wouldn't take stuff and had problems. I mean, I was just told of someone who had atrial fibrillation who didn't do the treatment and has had a massive stroke. I don't know what else she was doing, things that you and I offer people can offset that, including this. I think I might have even it's just it wasn't a patient, made a casual, like, there's these things you can use. And a lot of people like, well, I don't feel it. So
I think that's the big thing with bioregulators. I always say bioregulators aren't the big fireworks that peptides can often be. Peptides, generally, people, like if you're looking at BPC and someone's had an injury, like my mum broke a leg, 17 pins and 2 plates, and I put her on BPC, and she's was osteoporotic, and the thing healed. Like, it blew my brain how even her orthopedic was just like, how did it heal so fast? I'm like, wow,
yeah,
BPC.
right.
It's just like that blows my brains. And bioregulators generally don't have the big fireworks behind them, but they do just sit behind the scene and just make all the machinery just work better. And so I've learned, being someone who likes the firework stuff, that's why I like my peptides, but just to go, actually, if I stack them in on top of, like I'm using Cardilax at the moment, and I don't have that amazing result with BPC and TB stacked like a lot of people do. Cardilax, boy, do I notice that one. And my dog that
Yeah.
blew a disc, he's on Cardilax, and he went from severe nerve pain, and I just injected him with Cardilax, stole my Cardilax, and I gave that to him, and he's gone from couldn't walk, nerve pain, screaming, along with some acupuncture and some osteo work, and he's back out running around and having a great time. And that was quick, and that was quick, but that was just using Cardilax, which is the cytogen for cartilage. So like they
Which
don't.
has a place with heart and
Yes.
kidney, and so
Yeah.
there, and the conversation isn't pill for ill. Oh, I have kidney disease. I'll do the kidney bio. Oh, okay, I have a little. It doesn't work like that. It's like the body has so many different cell types. And so we kind of like weave all that together in a beautiful tapestry of, I believe I can get better.
Yeah. Well, I think that mindset's so important, isn't it? It's what keeps you driving to be curious and trying more things. Dr. Rose, anything else you want to say about the heart bioregulator before we wrap this up?
I think we've said plenty. I mean, I can go over research studies. I don't think that's that important. Yeah, they have done studies and people had wonderful outcomes, convincing enough to me to be taking it. I'm taking the heart bioregulator now.
Interesting.
I cycle it every now and then.
Yeah.
At first, I did a lot more. Now, probably every 3 months, I'll pop that one in. I mean, we have a whole array of them, and I go, I was part of a study that included all of them, which was how come I thought of this book, which I'll
I'm going
show
to say,
again.
plug yourself, plug yourself.
Beautiful, lovely book. I love my artwork. It came from a Ukrainian artist,
That's beautiful.
and he heard what I wanted and did it. I have a website, Renology, which, by the way, Renology is the art and clinical science of kidney success. I love that. Limbic system just went from failure, success. Really
Yeah.
changed your mind. So my website is renologyiskidneysuccess.com. I've been writing blog posts, which would be chapters in a book if I felt like going through that misery again. I'm like, I'm just going to put it on my website. I just did one on the stuff that's being put on food, a peel,
I
which
saw
actually has
I follow you. I saw that go up.
which has some nasty effects on various body parts, including the heart.
Yeah.
And you can't even wash the stuff off. So it's like, okay. Kidney mind says, pay attention, and so I think all of us together are teaching each other. People can reach out to me. I'm pretty good, sometimes slow, but more or less good at answering and you know, let's keep triggering each other to keep thinking about how we can float this boat. The one thing I wanted to say is the way I understand it, I live by the ocean, so I watch boats. Little boats, they turn around fast. I go, and I turn around. The big boats, slow turnaround. And the bioregulators are that slow turnaround. It took a while to get there. So it's unraveling stuff.
A great analogy.
It takes a while, So I'm like, yeah, that boat just turned around. You see the tugboat, it needs help, and so I feel like a big ship, and I've turned it around, and I'm not, I have the humility to know at any moment something could come, some traumatic thing, and would traumatize. And that's part of why I like to keep these bioregulators, keep the strength, keep that strength, keep your, it's insurance when a stress comes at you. And that was one of the things with the heart bioregulator, helps with stress tests. Okay, so maybe that's like you fall off a ladder. Here's a stress test right there. And do I have the resilience to recover from injuries and emotional traumas, which affect cardio? We know all of these things are connected. So,
Oh, I
yeah.
love it. Well, I'll put in all your details below. So if anyone wants to reach out to Dr. Rose, you can do that. We'll be back next time to talk about which bioregulator's next.
You were talking about Vylon.
Yeah,
And
let's do it. It's probably
yeah.
I reckon it's my favorite. I use that because I see a lot of patients with long haul COVID and post-vax stuff. So I've been using that left, right, and center because
Absolutely. Yeah.
yeah.
Yeah. I mean, that and Thymogen together are a fabulous combination. But Vylon, just like carnosine, 2 amino acids, teeny little thing, agile, does amazing
So
stuff.
agile. I love it because a lot of my patients will react to TA1. It reactivates viruses in my really sick patients. So I have to stick in Vylon first and then
Yes.
layer the other one in tiny little doses later. So I love it. So yes, let's do that. I'm probably got my, you've got your love affair with carnosine. I've probably got my love affair with Vylon. So well, I'd love to do that one next. So that'd be great. So if you want to know more about Dr. Rose, Renology's kidneysuccess.com. She has a wonderful blog post that she puts up there with some really great information. So I highly recommend you go and have a look at that. I'll put her website in there. You can get a book from that website as well. And any comments, you guys have been great about commenting on these videos and things that you want to ask. So again, put your comments in below and we'll make sure we address it in the next one that we look at. Make sure you hit like and subscribe. That way you'll get notified anytime we put up a new video. And if you want to know more about what we do, head to www.kidneycoach.com and you will find us on Instagram and Facebook under the same handles. Thank you for being part of our community, Dr. Rose. As always, it's a pleasure. Thank you so much for your generosity and knowledge and sharing it with me and with the community. I'm very grateful for you. Aloha.
Aloha.